please take your seats. We will start with a safety briefing.
Of the management of the Cascadia Hotel, I would like to extend a warm welcome to you. Your safety is a priority, and it is essential that you are familiar with our emergency procedures. The Health and Safety Act requires that we inform you that in the event of an emergency, an alarm will sound. When you hear this alarm, please remain calm and evacuate the building in an orderly manner. We have no planned fire drills today, so if you hear an alarm, please follow the green emergency exit signs and the directions that our security agent will provide. The muster station point is next to the main gate. Do not re-enter the building until the fire marshal has declared the building safe. Please ensure that you have not left any valuables in your car. If you need to secure an item, our front desk management team will be happy to accommodate you. Once again, we welcome you and hope you have an enjoyable experience here.
Well, thank you for the safety briefing. I invite you all to stand as we observe the national anthem, please. Of liberty in the fires of hope and prayer, with boundless faith in our destiny, we solemnly declare. Side by side we stand, islands of the blue Caribbean Sea, this our native land. We pledge our lives to thee. Here every creed and race find an equal place, and may God bless our nation. Here every creed and race find an equal place, and may God bless our nation. Thank you all. Please remain standing as I invite Nurse Desiree Baird, our Primary Care Nurse Manager, County St. George Central, to lead us in prayer.
Good afternoon, everyone. Please bow our heads. Eternal Father, God of all blessings, source of all life, giver of all grace, we thank you for safely bringing us here to this event this afternoon. We are gathered here to celebrate our achievements, and we anticipate your continued guidance for our future successes. Father, we pray for your richest blessing on our NWRHA board, the executive, our managers, and our employees, and all who are gathered here with us to celebrate this afternoon. Heavenly Father, we come with humble hearts and with renewed gratitude for all the blessings you have bestowed upon our RHA. All that we have accomplished, we acknowledge that it comes from you. Fill us with the satisfaction at the great work we can accomplish for the sake of our organization and those whom we serve. Guard our hearts from pride and selfishness, and keep love at the forefront of our minds. For this new fiscal year, we pray for your continued blessings and guidance, and to accomplish extraordinary strides in healthcare. Equip us with your wisdom, O God, and humility as we do our best for you. Lord, make your face to shine on us and be gracious unto us. All these we ask in your holy name. Amen.
Thank you, Nurse Baird. You may have your seats. Chairman of the Board of Directors of the NWRHA, Ms. Lisa Agard, Deputy Chairman, Dr. Leslie Roberts, Directors of the Board, CEO of the Northwest Region, Major Anthony Blake, Chairman of the Sanwa Laventille Regional Corporation, Alderman Richard Walcott, CEO of the Tobago Regional Health Authority, Mr. Garth Alexander, CEO of the Community Hospitals of Seventh-day Adventists, Dr. Stephen Carrill, representatives of the business sector, employee associations, private health organizations, specially invited guests, executive management team, staff of the NWRHA, the general public, online viewers, and members of the media. Good afternoon, and a warm welcome to the Northwest Regional Health Authority's Public Board meeting. My name is Keisha Lewis. I am the General Manager of Mental Health Services, and I will be your host for this afternoon's proceedings. Thank you to all persons here, and I would also like to recognize our online audience as we are currently streaming live on Facebook and YouTube. I would now like to introduce to you members of the NWRHA Board of Directors. Ms. Lisa Agard, Chairman. Dr. Leslie Roberts, Deputy Chairman. Dr. Sahid Rahman, Director. Ms. Nicole Ullery, Director. Ms. Deborah Lewis, Director. Ms. Jessica Harrigan, Director. Ms. Edna Adley Graves, Director. Mr. Johan Sambrano, Director. We will now welcome remarks brought to you by the Chairman of the Board of Directors of the NWRHA, Ms. Lisa Agard. Madam Chairman.
Keisha, thank you so very much. Good afternoon, everyone. All protocols observed. It seems as if our new national anthem it's a vibe. But it's not. Notwithstanding the fact that all protocols are observed, I want to warmly welcome all staff present and a special good afternoon to the media. On behalf of the Board of the Northwest Regional Health Authority, it is my pleasure to welcome you to the Authority's Public Board meeting for 2024. I welcome those of you who are here with us in the audience today, as well as those of you who are joining us virtually. Our exercise today seeks to fulfill a key element of the Authority's mission, that is, to demonstrate accountability, transparency, and integrity to you, our key stakeholders. We intend to showcase our commitment to our mission through the public review of the Authority's performance during the fiscal year 2022 and 2023. We also intend to give you the opportunity to share your concerns, ask us questions, and to provide feedback as to how we can improve on how we deliver healthcare to you. With an estimated 816,340 patient encounters being recorded over the last 2 fiscal years, it is imperative that the Authority maintains a constructive rapport with its patients and staff and general public. As I bring you greetings, I would like to touch on a few areas which are at the heart of our purpose. I intentionally will not cover everything because, as you can see from the very thick booklet on our desk, there is a very extensive presentation that will be given to you by the CEO. But I want to touch on a few areas. Communicable and non-communicable diseases. The high incidence of both communicable and non-communicable diseases continues to be a burden on healthcare systems across the globe. The World Health Organization has estimated that communicable diseases, including HIV and AIDS, and sexually transmitted infections, are among the leading causes of mortality and disability in low to medium income countries and marginalized populations. As far as non-communicable diseases are concerned, WHO estimates that each year 17 million people die from non-communicable diseases before the age of 70, with 86% of those cases being classified as premature deaths. In support of the reduction of those statistics, the Ministry of Health outlined the strategic direction for the prevention and control of non-communicable diseases, to which the NWRHA has wholeheartedly subscribed. The authority has focused its efforts on the promotion of health habits through health education for the prevention of diseases and the facilitation of health screening for early detection and effective management of disease. As such, we have adopted a more comprehensive approach to our health promotion activities, which include our care fairs and the workplace wellness program. Over the last fiscal year, we were able to satisfy the requests of 97% of the people for health screening services, and we were also able to execute 92% of all planned health promotional activities. Approximately 6,000 persons were tested by the authority for HIV/AIDS over the period, with 3 dedicated HIV testing campaigns being executed during that time. A total of 78 educational sessions on HIV/AIDS and STIs were done for the period, with an estimated 1,842 persons being reached. You know, sometimes we take for granted the hard work done by all the various departments in the NWRHA, but I'd like to especially commend the health promotions team, because they do an amazing job in these care fair programs and these wellness outreach sessions. And it really redounds to the benefit of the communities in which we live. And we expect to see, as a result of that outreach, significant reductions in non-communicable diseases. As you all know, at the NWRHA, we have responsibility for 2 key areas of health. 1, mental health services, and 2, cancer care services. To get to this location, you would have had to pass the St. Anne's Mental Hospital. And I urge you all, if you have time, liaise with Keisha, you should really go and pay a visit to that important institution. And I think you will have a much better understanding of the provision of mental health care in Trinidad and Tobago. And you will see the very difficult work that the dedicated staff have to contend with this very special category of patients. We are the main mental health services provider throughout the country, and during the reported period, we expanded our therapeutic services, commenced our memory clinic, and engaged in mental health outreach, and commenced planning for the refurbishment of the ARIMA Rehabilitation Center. In the area of cancer care services, the authority introduced the Linear Accelerator in June 2020, or LINAC, which expanded and improved radiation treatment options available at the Cancer Center of Trinidad and Tobago, then the National Radiotherapy Center. The LINAC enhanced the delivery of radiotherapy services by improving the precision, efficiency, and scope of treatment available to cancer patients. Over the reporting period, the authority aimed to optimize LINAC services with the goal of increasing the number of patient treatments provided annually and reducing the waiting times for patients to receive radiotherapy treatment. Since its inception in 2020, there has been an estimated 17,041 patient visits at the LINAC facility. Digitalization at the Northwest Regional Health Authority, a subject that is very near and dear to my heart. As Trinidad and Tobago embraces digitalization in the country, healthcare cannot be left behind. The NWRHA has made significant strides in implementing a health management information system. The authority has been able to adopt an electronic health platform for patient registration, patient records, and pharmaceutical management. The platform was expanded to all hospitals and health centers under the purview of the organization during the reporting period. The platform was also utilized to provide coverage for health outreach events, linking patient data for seamless recall of all health encounters with the authority for patients. Use of the eHealth platform has led to a reduction in patient wait times, ease of access to patients' basic information by clinical professionals, and a reduction in cost associated with expired pharmaceuticals. And those savings amount to hundreds of thousands of dollars. What does the future of digitalization look like for the authority? An expansion of the eHealth platform in fiscal year 2024 to support the maternity department at Port of Spain General Hospital, the introduction of a module dedicated to patient bed management, the expansion of capabilities for the eHealth mobile application, and lastly, increased interoperability between the eHealth platform and existing health information systems such as the lab information system and health databases. When the central block becomes available in 2025, right, Dr. Barrow? We envisage the implementation of a comprehensive eHealth platform that integrates with all vital monitoring systems, surgery, inpatient care, all practices at the Port of Spain General Hospital, laboratory, and radiology. We will be the only RHA, right, Mr. Tobago? We will be the only RHA with such a comprehensive digital eHealth platform in Trinidad and Tobago. And we use the data and the dashboards produced by the platform so that we can tell you that approximately 118,600 patient registrations and 397,000 prescriptions have been dispensed by the eHealth platform. Noteworthy is the fact that the system presently has patient registration data for approximately 328,000 patients as health legacy data was transferred to the eHealth platform. We presently have an estimated 1,643 active internal users on the eHealth platform, the users being health workers utilizing different facets of the facility to provide services to our patients. And as of January 2024, the eHealth mobile app, and I urge you to download the application, it has over 4,600 subscriptions. Infrastructure. There's one project at the NWRHA that consumes a considerable amount of our time, all of our time. And that is the construction of the new central block at the Port of Spain General Hospital. We are happy to report that during the last fiscal year, the authority successfully demolished the old central block and is in the process of constructing the new central block. Port of Spain General Hospital continues to be one of the major public health facilities in the Northwest region, as it services more than 30% of the 1.3 million total population of Trinidad and Tobago. The redevelopment of the new Central Block project underscores the vision of the Port of Spain General Hospital campus, a transformative model that will see Port of Spain General Hospital become a premier teaching hospital. And that's not just in Trinidad and Tobago, but all across the Caribbean, and a state-of-the-art public health institution within the country. And that's why we really have to have a comprehensive e-health platform. My colleagues on the board are tired of hearing me say that there is little point in additional physical infrastructure if we do not implement side by side with such physical development e-health platforms and capability that improves the ability for the institution to offer health services in a more effective way. I just want to tell one little story that really pleased me intensely about the e-health platform and how effectively it can work in the system. A patient was at one of the health facilities, I think the one in Las Cuevas, and the doctor prescribed a pharmaceutical for her. It was not available in Las Cuevas. The doctor simply went on the system and said, oh, actually, it's available at the Maraval Health Center. So she said, okay. He said, no, I'm going to do one better than just telling you where it is available. I am actually going to write this prescription for you electronically so that when you get to Maraval, it will be ready for you and you could simply pick it up from there. Otherwise, in normal circumstances, that poor patient would have had to drive to every single health center in the Northwest looking for the available medicine. This is what we can achieve in terms of helping our patients lead more productive lives by making their interactions with the Northwest Regional Health Authority more seamless. The last area I'd like to just talk about a little bit is our human resources and staff engagement. We are nothing without our people. And we have to ensure that our internal stakeholders, our dedicated staff, are thoroughly engaged in our efforts. In order to maintain commitment, empowerment, and staff morale, the authority facilitated multiple staff engagement activities throughout the reporting period. And I do apologize that I missed the carnival party last week. I understand, and I actually saw videos, but I will not tell tales out of school. We have curated support for our staff through the development of a robust employee assistance program, which provides an array of services, including counseling and social support and services and routine health screening for diseases around observances such as World Cancer Day, International Women's Day, and Father's Day. We have also provided opportunities for positive socialization through the facilitation of staff-centered activities such as hikes and our Sports and Family Day in 2023. Who won the March Pass again? Well, somebody has complaints about the judging? But seriously, we know the value of employee recognition, and so we have executed several employee appreciation and award activities, as well as academic awards for children of our employees. As I conclude my opening remarks, I would like to thank the former acting CEO, Ms. Salisha Bash, for her unwavering dedication and commitment during the COVID-19 pandemic. Salisha, without your leadership during that critical time, we would never have been able to function effectively. The NWRHA really owes you a deep debt of gratitude. I would also like to thank the present CEO, Major Anthony Blake, for his continued innovation, dedication, energy, and willingness to lead in the ever-evolving public healthcare landscape. The Board of Directors takes this opportunity to thank members of the executive management team for their commitment to the authority as we continue to make strides in the achievement of our vision and mission. We would also like to thank other members of staff of the authority as they contribute to the sustainable development of healthcare services throughout the authority. Finally, we would like to acknowledge the citizens of Trinidad and Tobago and all our patients who remind us daily of why we must press on and continue to serve diligently. And I'd also like to thank my colleague directors on the board who patiently deal with me on a monthly basis. Thank you for all of your support and commitment. We are proud today to host this public board meeting, and we hope that the information presented here today brings comfort to the public that the authority is dedicated to the provision of clinical excellence through innovative, integrated, and evidence-based healthcare. I look forward, along with the CEO, to taking some of your questions at the end of his presentation. Thank you so much.
Thank you, Madam Chairman, for your welcome remarks, which really sets the tone for this afternoon's proceedings. On the screen, you will see the QR code. If you scan this, you will have access to the agenda and other documents, and you can scan it from where you're seated, well, depending on your phone. All right. Okay. So we will now have the presentation by Major Anthony Blake, CEO of the NWRHA, who will provide a report on the authority's activities. We ask that you take a note of your questions and comments and kindly reserve all questions and comments for after the presentation. For those of you online, please feel free to post your questions and comments in the chat, and we will address this in the question and answer segment following the presentation. CEO.
Thanks very much, Keisha. Let me start by thanking my chairman, Ms. Lisa Agard, chairman of the Northwest Regional Health Authority, and I think we owe the chairman another round of applause for her performance today. Yes? Deputy Chairman. Chairman, do not let cat out of the bag as yet. We have some surprises for them. Deputy Chairman, Ms. Leslie Roberts, thank you for your support, and the clinical and other staff executives will know that Ms. Roberts, Ms. Agard, and the board members, I want to say to the team here, are not just normal board members. These board members are very receptive to the needs of the executive and have gone above and beyond the call for the executive and staff of the Northwest Regional Health Authority, and I recognize the other directors present today. Thank you. My colleague, CEO of the Tobago Regional Health Authority, Mr. Garth Alexander, thank you for coming to Trinidad to see how it's done so that you can go back to Tobago and so on. It's not a problem, brother, I have you. All right. CEO of the Community Hospital, Mr. Stephen Cyril, representatives of the business sector. I also want to recognize Mr. Edie Stewart and his team here, my good friend, my agree to disagree partner and so on. And Chair, even though you missed NWRHA's Carnival event, I'm sure Mr. Stewart can brief you. He was most present at the event.
I saw the videos.
Let me also recognize the executive and staff, hard-working staff and executive of the Northwest Regional Health Authority. I want to say at the onset that I'm extremely proud of you all, as I'm sure the board is, and I think the presentation today will demonstrate the work that you all have done over the last 2 financial years. Let me also say good afternoon and welcome to the persons online, the media present, and even the staff of the Cascadia Hotel. Thank you for being here. So on behalf of the Northwest Regional Health Authority, it is indeed my pleasure to present this public board presentation, which covers the last 2 financial years, 2022 and 2023. Amidst several challenges that the Northwest Regional Health Authority has faced in this period, we continue to produce and provide clinical excellence with compassionate care to the best of our ability. Our greatest strength is demonstrated through our greatest asset, our employees, who are guided by our vision and mission for the authority. In today's presentation, we will identify and remind persons of our vision, mission, and core values. We'll highlight the services that are presently offered at the Northwest Regional Health Authority. We will explore our strategic health priorities, and then we will showcase our performance for the financial years under review, which will obviously include our key achievements, initiatives, and a financial overview of the government's and taxpayers' money and spend, which is ever so important. Lastly, we will identify our projections in support of our strategic direction. We'll look at where we're going in financial year 2024 to 2025. And we should be reminded that the vision and mission of the Northwest Regional Health Authority are essential to our existence, and is at the heart of the institution's operations. Our vision is to be, of course, the leading healthcare provider in the Caribbean, delivering clinical excellence through innovative, integrated, and evidence-based healthcare. We intend to achieve the vision through fulfillment of our mission, which includes transformative factors such as accountability, integrity, corporate responsibility, and commitment, as well as empowerment. Our core values, 6 core values that we live by at the Northwest Regional Health Authority. Firstly, and obviously, high quality service, a commitment to being client-centered, development and well-being of our employees, and our chairman would have spoken about that today, mutual respect for all, recognition and rewards, and obviously the provision of an enabling work environment. These core values underlie the competences that make the Northwest Regional Health Authority an effective public health care provider. We now delve into the services provided at the Northwest Regional Health Authority, and as many of you would know, we were established in 1994. The Northwest Regional Health Authority's geographic boundaries extend from St. Joseph in the east to Las Cuevas in the west, the Churchill-Roosevelt Highway on the southern boundary, and Carenage and Chaguaramas proper on our western boundary. NWRHA serves a total of 300,000 residents and a commuting population which many don't take into consideration of approximately 200,000 persons that are working in and around the city of Port of Spain and environs. The NWRHA manages 3 hospitals, 1 district health facility, 17 health centers, 3 mental health and wellness centers, and 2 centers dedicated to rehabilitative treatment Additionally, the authority supports several mental health satellite facilities across Trinidad, and this is important to note because mental health is a key deliverable not only for the NWRHA, but for the Ministry of Health and by extension the Government of Trinidad and Tobago. The NWRHA is the foremost provider of mental health services, and our employees service all mental health facilities across all regions in Trinidad. We next take a dive into the Port of Spain General Hospital, and you see the plethora of services that we provide there. Port of Spain General Hospital obviously continues to be a major, did I say major? You know, my name is Major, so I will emphasize that every time I see it. A major public healthcare facility in the West, the vast range of medical and surgical services. Prior to the 2018 earthquake, the Port of Spain General Hospital had a bed capacity of 574 beds, and I want you all to really keep that in mind, 574 beds. This number was drastically decreased due to the decanting and decommissioning of the central block after the earthquake, obviously. The authority has worked assiduously to increase bed capacity at the institution through further development at the North Block. We would have refurbished areas in the North Block to create additional wards. We'd have also created additional beds in Observation 1 and 2. We'd have also refurbished the Costat building to create additional space. Notwithstanding our best efforts, our bed count today stands at 257 beds, and that includes the maternity department. I don't want this point to be lost on the audience today, both in person and online, because going from 574 beds to less than half of that has had a serious impact on our ability to provide the level of service that we need. There is, however, light at the end of the tunnel, and with the coming of Central Block that we would speak about later in this presentation, we should add approximately 540 beds to our stock. But it is important to note that the staff, since the decommissioning of the Central Block, has been working under tremendous pressure and has put their shoulders to the wheel and has diligently pushed and continued to provide every service that Port of Spain would have provided with the 574 beds. I want a round of applause for my staff. We next move to the St. James Medical Complex, which is again a feature of our presentation. You would see that Northwest, I believe, the Northwest Regional Health Authority has the most so-called centers of excellence. So we would see our Center of Excellence for Mental Health and now a Center of Excellence for Oncology at the St. James Medical Complex. And the St. James Medical Complex is an institution of great importance to the NWRHA as it acts as the epicenter for oncology services in Trinidad and Tobago. And we know, as the chairman would have reminded us, that the Linear Accelerator was commissioned in 2020, and it is the first of its kind in not only in Trinidad, but in the Caribbean. This represents in the public sector, you see? So you see how the board meeting does go, and we're in a public board meeting. So that's one, and we're counting them today. And I always thank my chairman and vice chairman for their advice and so on. Some of the services at St. James Medical Complex are listed here, but the slide is really too small to show everything that we do at the St. James Medical Complex at Port of Spain and at our primary care and mental health facilities moving forward. We next move to the St. Anne's Hospital, and the provision of mental health services is one of the unique services at the authority. Again, another center of excellence. The St. Anne's Hospital provides inpatient mental health care to the entire population of Trinidad and Tobago. The inpatient care includes services such as psychiatric inpatient care, psychology services, psychiatric social work services, forensic services, and rehabilitation services for both adults and children. The St. Anne's Hospital has oversight of 3 mental health and wellness centers and 2 centers dedicated to rehabilitative treatment under the authority and provide support, as I said before, for mental health services across the country. Our bed capacity there is approximately 725 beds. We next look at primary care, the all-important primary care, and we'll speak a lot about primary care and its impact at the Northwest Regional Health Authority and nationally. When we dive a little further into primary care services that we provide, the slide provides an illumination of the services that we provide under primary care, but primary care really acts ideally as the first line of treatment or the first contact with the population. Through the provision of primary care health services, the authority continues to focus its attention on disease prevention, on early detection through regular health screening, as well as community health and support for the most vulnerable members of our society. Regular clinic services are provided during the hours of 8 a.m. and 4 p.m., Monday to Friday, and at any one of our 17 health centers located in St. George Central and St. George West. Extended hours health services are provided at 7 health centers from 4 p.m. to 9 p.m. on Monday to Friday, and at 8 to 4 p.m. on a Saturday. And what is important in this presentation is to understand the strategic priorities of the organization, because from these strategic priorities that the board would have given based on the ministry's direction to the management of the authority, we get our work plan. We decide how we progress and proceed through the board financial years that are under reviews. And for the reporting period, these strategic priorities would have come out of our Vision 2030, and the Ministry of Health's strategic plan, and they include prevention, treatment, and care of non-communicable diseases. Secondly, the prevention, treatment, and care of communicable diseases, maternal and child health, health, human resource planning and development, patient care and customer service, health infrastructure and facilities management, modern health information systems. Each one of these areas will be expanded on, but before I expand on these areas, we will first take a look at what our strategic and core institutional priorities are for fiscal year 2024 to 2025. And they include, obviously, as Chairman would have said, the redevelopment of the Port of Spain General Hospital campus. So it's not just a central block that we're replacing. It's really, as she said, an integrated campus model that covers the creation of the new patient tower, the addition of millions of dollars in equipment, and how that integrates with the existing Port of Spain General Hospital. It's not a new hospital, it's an old facility that now has to be integrated with a new patient tower and other ancillary service, and we'll speak a lot about that moving forward. Optimization of oncology, and the chair would have also spoke about some of the performance indicators that we would want to see in terms of increased amount of treatment hours, increased amount of accessibility to patients and so on at our oncology center, and better utilization of the service in total at the oncology center. We'll really focus this year, as we've been focusing over the last periods, on decentralization of mental health. And you would see that a feature of the outreaches that Northwest has done in the recent past is that mental health is now at the forefront of what we did. Mental health used to be in a booth in the side, on the back of the health fair, and now when you go to a health fair, you would see that mental health is always included in Northwest, and it has a position of prominence in the health fair, and that is a dedicated effort to reduce the stigma that is associated with mental health. It must start with us, and obviously, board meetings go like that too sometime. Right. Fourth, we look at the strengthening of primary care health services, and this is extremely important to us because we realize by strengthening primary care, we can stop the multiplicity of persons that come to Dr. Barrow's accident and emergency at Port of Spain General Hospital. Many people present at the accident and emergency at our tertiary level institutions for ailments and illnesses that can be dealt with at the primary care level. If we can strengthen primary care to the extent that the population understands the level of services that you can get in primary care, a lot of these people will not filter into the tertiary level institution. So we're going to strengthen that area as we've been doing thus far. So we go back to our 6 areas, and we're going to expand a little bit on each one of these areas so that you understand the work of the authority and whether or not we're actually achieving the strategic priorities set out by the ministry and the board. Thanks very much. Drink a little water here, boy. Water is life, and as I drank that water, I just want to put in a plug for our programs that we have our outreach that speaks to drinking more water and continuing to move a lot and so on. So you'll see me drinking a lot of water today. So prevention, treatment, and care of non-communicable diseases. NCDs, such as heart disease, cancer, diabetes, are the leading causes of mortality and morbidity in Trinidad and Tobago and the wider Caribbean by extension. The disease shares common risk factors, including but not limited to poor diet, lack of physical activity, tobacco use, and harmful use of alcohol. Is anybody here familiar, other than staff, with the TT Moves campaign? Yes? So TT Moves targets exactly what we said here: reducing tobacco usage, drinking more water, moving, proper diet. And as we go through some of the dashboards that I will present later, you would see in it things like an increased utilization of our nutrition clinics under Ms. Monroe in patient support and so on. You would see coming out of COVID that a high percentage of the population are much more concerned about NCD-related complications and so on, and they've availed themselves of the opportunity to come to the health centers and the outreaches to get the necessary education in that regard. The next dashboard, or this dashboard, speaks to the leading causes of mortality in Trinidad and Tobago, and the World Health Organization in its global health estimates for 2019, and 2019, because this is the last data that is available from WHO, has indicated that the leading cause of death in Trinidad and Tobago were NCDs, which accounted for 83% of total deaths occurring within this island. I mean, I want to just read that again. 83% of total deaths are because of NCDs. And you see why the chairman would have focused in her speech on NCDs and why it's important for us to put resources and to make NCDs and the treatment of NCDs a strategic priority, because the Northwest Regional Health Authority is a data-driven organization, and we align resource allocation with the areas of concern. So this is data that is not cannot be refuted, and we have taken a serious look and have aligned our programs, our resources, and our services towards counteracting this. As a result, the Ministry of Health continues to work with the RHAs to execute initiatives and programs strategically focused to prevent and control the spread of NCDs. So what has the Northwest Regional Health Authority actually done, right? Other than the CEO talking here and saying that we're aligning the strategic priorities and so on. So let's look at what we've actually done over the periods in question. So the authority has a multidimensional approach to addressing NCDs and considers prevention, early detection, and management of NCDs as a key priority. The utilization of NCD clinics in primary care over the reporting period remained relatively high due to continued prevalence of NCDs within the population. It's not going down, it's actually going up within the population, and that is why the TT Moves campaign and other campaigns seek to educate persons about healthy lifestyles. There has been a noted increase of approximately 4% utilization in NCD clinics across the NWRHA from approximately 23,000 visits in financial year 2022 to 24,000 visits in financial year 2023, resulting in a total of more than 47,000 persons that would have visited our NCD clinics. That is no small achievement, people, and I want to say to the persons in primary care, seeing 47,000 persons over a 2-year span is a great achievement in that regard. I want a little applause from our primary care people. Dr. Bagan and team, we salute you. So even with NCDs, we must have special areas of focus because, again, we're data-driven and we're looking to which NCDs we need to focus on and where we need to challenge that focus. And the authority has also offered NCD specialty services at the primary care level. These include a focus on skin, diabetes, I want to say diabetes again, and nutrition care, among other areas. For the reporting period, there was a total of 11,228 visits to these specialty clinics. There was an overall 38% increase in utilization of these services from one financial year to the next, with a notable 29% increase utilization in the dietitian's clinic for the same period. People want to know how to eat healthier. The dietitians at Northwest always have work. They rove from health center to health center, and the dietitian clinics are oversubscribed at the Northwest. So some good work from the patient support department providing that support for persons, because even prevention is better than cure. And you would see our dietitians at all our health outreaches. They have a famous, I call it a famous, it's not a smoothie. It's a drink that you normally get at the Northwest once you come to one of our clinics. Is it pineapple and watermelon with ginger, no sugar? We're going to patent that and do a nice thing in time to come. We next move to another one of our very important wellness clinics, and this clinic is the brainchild of the ministry and the Minister of Health by extension, which is our diabetic wellness clinic. And the diabetic wellness clinic was launched in January 2023 at the Diego Martin Health Center. Specialty clinic offers an array of innovative diabetic-related services such as foot care, retinopathy screening, HbA1c testing, as well as diet and nutrition counseling. It is an all-in-one suite for persons that have a high HbA1c rating. We refer them to this clinic. The clinic is held once a week at Diego Martin, and we bring to bear the full resources, full clinical resources of the NWRHA at this facility to deal with intervention for persons that are high risk in these areas. And we've seen significant progress in helping persons reduce their levels to manageable levels. For the fiscal year 2023, 80% of all our primary care physicians were trained in foot care management. Why is this important? Anybody that experiences, any family member or anybody that knows anything about diabetes will understand that foot care is one of the most important parts of it. And again, being a data-driven organization, we thought that we needed to focus much more on training persons in foot care and clearing of diabetic wounds and so on. And we focused a lot of our training for our physicians in these areas, both our nurses and doctors. We'll next look at some of our major primary care services. And in addition to our specialty NCD services, the NWRHA provides an array of services and clinics throughout primary care health centers. The clinics include chronic disease, child welfare, postnatal and antenatal, general practitioner, and dressing, to name a few. And all our clinics across the RHA are well subscribed, every single clinic. I want to say here that the Diego Martin Health Center, which is coincidentally our newest health center, has the highest level of utilization across the RHA. You know, they say sometimes people like Newton or whatever it is, but Diego Martin is extremely heavily subscribed, as is Barataria Health Center and Sawo in these very, very high levels of utilization at those health centers. There was an 8% increase in utilization of major clinics and services under primary health care in between the two financial years, and the highest increase in utilization was noted for bloods and general services. Many people don't know that you can get a slew of blood tests at our primary care health facilities. They believe that you must come to hospital to get it, but in primary care you can actually get most of the blood tests that you would get at hospital. Our school health program is one that is also significant and very important to us because prevention is better than cure. And you must start that education from the nursery level. And as I said, our school health program ensures that primary school students are assessed for health-related issues at key stages of their development. In financial year 2022, the school health program was halted, obviously because there were no in-person classes due to COVID, and the kids were at home, being homeschooled and so on. But we have come back with a bang, and by the numbers that you see in front of you, you can see that the school health program is significantly impacting the way that we do business at the RHA. We have in fact touched 146 schools and have seen in excess of 3,700 students. We've also immunized more than 1,000 students, 1,200 students in this run of our school health program. So my chairman spoke about health promotion and the importance of health promotion to the RHAs, and the fact that the only RHA that has a dedicated health promotion unit is the Northwest Regional Health Authority. The health promotion unit is a key tool in getting the information out there. 90% of the initiatives that we put on, the outreaches to the public, to schools out there, is coordinated by the health promotions unit, and they have done a fantastic job of that. If you look at the numbers, we have done 126 workplace wellness programs for both public and private sector. We've done over 100 community-based interactions for the general public. We've done a number of interactions with faith-based organizations. And obviously, we've been in the schools sharing the message of good health and proper health practices. I'm glad the audience is starting to catch on. I don't have to ask anymore. Just get the cue. Good performance is good performance, and it deserves what it deserves. So more health promotion information. So we look now at health promotion screening, because a big part of our health outreach is providing that capacity to screen people for NCDs and other diseases and so on. And look at the numbers here. It is not in red and bold just by coincidence. It is because we want you to recognize that we have touched over 46,000 persons in our health screening. Right? If you look at the Northwest Regional Health Authority's social media page, you would see almost weekly we are out there, whether it is in PTSC, we're on the promenade, we're in the malls, we're in all the spaces that people move and interact in, spreading the good message of healthcare and trying to promote and prevent NCDs and other communicable and non-communicable diseases. And in this regard, we've done thousands of blood pressure tests, blood glucose, and all the tests that you see in front of here, which is too numerous to mention. If we continue like this, you're just going to be clapping, and you're all not going to be hearing me. So, health promotions, you already get a clap, so Shemaiah blushing in the corner there. So let's talk about virtual health promotion outreach during COVID-19. Obviously, because of the restrictions with COVID-19, we couldn't do in-person health outreach because we had social distancing protocols and so on. And during COVID-19 pandemic, our health promotion strategy had to evolve to treat with the restrictions of the outreach that came with the pandemic, and the authority increased its development and publication of digital posters, newsletters, videos, etc., to ensure the continued health outreach to the population and the wider country. The content included health tips related to nutrition, NCD management, and mental health. And a lot of this health outreach dealt specifically with issues in terms of coping with COVID and the mental issues that came along with being shut in and not being able to work, being confined to a space. So over 40 digital content items were developed over the period, and approximately 18 international health observances were commemorated via the publication of digital content. And I mean, this is incredible, because you can sometimes look at a situation like COVID and say, you know what, we can't do no work because we are health promotions, so we can't go into the public spaces. So CEO, we staying home, it had nothing to do. But you know what they did? They evolved. They went digital, and Chair spoke about NWRHA's drive to digitization. This is all part of it. The way we reach out and touch people has to change, because where is my phone? That little thing you call the phone now, that transforms every facet, every way that we do business. I mean, my kids don't even watch television again. Everything is the phone or a tablet. And when they grow up into this society, a lot of the things that we do now and the way we do things are not going to be relevant. So Chair spoke about the health information app and so on. And while the adoption of it for us might be slow, it's not going to be for them. If you don't have it on an app, they're not going to use it. We next want to talk about our annual research day, which is another feature that has been put on over the last 5 years by the HPRP department, and the authority really continues to promote evidence-based healthcare management through the facilitation of our annual Research Day Symposium. This event provides a platform for dissemination of health research and networking among researchers, healthcare professionals, and other public and private stakeholders across the field. Since its inception in 2017, the authority has hosted 5 Research Day events. For the reporting period, 2 research days were held, which featured a whopping 95 research studies. Is there a need for something like this? If we have 95 people presenting studies, and there were those who sent in days late and they weren't able to participate. But we see there is a need for health research, and we are providing that outlet for persons that want to so do. Just to remind you all, our 5th annual Research Day was held in April 2023 under the theme Mental Health, Reframing the National Perspective, which explored the importance of mental health and its impact. What are we seeing here? As I talk, you're seeing that the Research Day was based on mental health, right? That is not coincidental, because Northwest is putting mental health at the forefront. So even things like Research Day, what we've done is to make a conscious effort to put mental health at the forefront of what we do. Because I've talked so long and my mouth is a little white, I want to call on Ms. Keisha Gangaram now, my App Director of Health, to assist me with the next part of this presentation.
Good afternoon, everyone. Thank you, CEO. So we're touching on the accident and emergency services at the Northwest Regional Health Authority. So our accident and emergency departments and the assessment and admission units at the St. Anne's Hospital serve as a major admission point for patients who require extensive inpatient care. So since the reduction of beds at Port of Spain in general due to the 2018 earthquake, the Northwest Regional Health Authority has increased its effort to streamline the care pathways at the emergency departments. The Port of Spain General Hospital's Accident and Emergency Department encountered a total of 80,612 patients during the reporting period, with a 4% increase in patient encounters from fiscal year 2022 to fiscal year 2023. The Port of Spain General Hospital also recorded a total of 36,721 ward admissions and 36,871 discharges for the reporting period, with an average length of stay across the institution measured at 3 days in fiscal year 2022 and 4 days in fiscal year 2023. The Port of Spain General Hospital experienced a 28% increase in ward admissions in fiscal 2023 when compared to 2022. Similarly, there was a 29% increase in discharges in 2023 when compared to 2022. With respect to lower limb amputations, a total of 170 were performed at the Port of Spain General Hospital for the reporting period, which represented a 2% increase over the 2-year period. Also, 170 new patients were enrolled in end-stage renal disease treatment, with a total of 11,811 hemodialysis sessions being facilitated for fiscal years 2022 and 2023. At the NWRHA, a total of 1,240 cataract surgeries were performed during the reporting period, with a 9% increase in the number of procedures in 2023 when compared to 2022. The St. Anne's Hospital Assessment and Admissions Department experienced a total of 5,312 patient encounters for the 2-year reporting period. There was a 9% increase encountered from fiscal year 2022 to 2023. the St. Anne's Hospital experienced a total of 3,557 patient admissions and 3,584 patient discharges for the reporting period, which represents a 6% increase in admissions and an 8% increase in discharges when comparing fiscal years 2022 and 2023. The NWRHA has embarked on various initiatives to reduce admissions and increase discharges. These include the decentralization of mental health services to other sites, the reorganization of acute beds, tighter gatekeeping, and the maintenance of high standards for admissions according to the Mental Health Act. The NWRHA manages 3 mental health and wellness centers within our catchment area. These are Barataria and Pembroke Street Mental Health and Wellness Centers, as well as the Diego Martin Behavioral Wellness Center, as mentioned was launched in October 2020. Also previously mentioned, the NWRHA manages satellite units located at other RHAs across the country, namely the Tacarigua, Arima, and Chaguanas outpatient clinics, which function within the North Central region, and the Sangre Grande, Mayaro, Rio Claro, and Toco outpatient clinics, which operate within the Eastern region. It should be noted that the mental health outpatient visits have been on an upward trend since 2018. At the end of fiscal year 2023, there was a 9% increase in the utilization of mental health and wellness centers from fiscal year 2022. This increase highlights the importance of the provision of mental health services in the community. As mental health services continue to become decentralized across the country, the NWRHA remains committed to providing mental health care services and collaborating with other RHAs and the Ministry of Health towards the implementation of the mental health policy. The Mental Health Services Department executed all requested mental health outreaches for the reporting period. The Child Guidance Clinic engaged in numerous activities, including screening, medical visits, psychiatric evaluations, psychological testing, school and home visits. A total of 9,011 visits were conducted during the period. Outreach services were facilitated for the Student Support Services Department of the Ministry of Education, the Municipal Police Service, the Judiciary of Trinidad and Tobago, and the Children's Authority of Trinidad and Tobago. The NWRHA launched its first memory clinic in March 2022 at the Pembroke Street Mental Health and Wellness Center. This clinic is one of 2 that operates in the public healthcare system. It provides timely diagnosis, treatment, and support for patients with dementia, Alzheimer's disease, and/or cognitive decline. There was a total of 120 patients visits during this period. Additionally, during the reporting period, the music therapy program, which is a form of psychosocial rehabilitative therapy for patients, was expanded to the Substance Abuse Prevention and Treatment Center, which is located at the NWRHA Hospital, located in the North Central region, but managed by the Northwest Regional Health Authority. So in our efforts to strengthen mental health services, we have commenced planning to optimize the Arima Rehabilitation Center, which is a transitional mental health facility governed by the NWRHA. The optimization services at the Arima Rehab Center include inpatient rehabilitation, individual and group interventions, daily exercise and healthy lifestyle programs, regular review of progress through individual recovery plans, and discharge planning and support for individuals as well as their families. Our projective optimization plans include the introduction of navigators to assist patients with the entire rehabilitation process, the opening of a day hospital, and the development of a transition program to integrate patients who are well back into society. Okay, we move on to St. James Medical Complex. The Accident Emergency Department at the St. James Medical Complex experienced a total of 26,452 patient encounters for the 2-year reporting period, with a 23% increase in patient encounters from fiscal year 2022 to 2023. The St. James Medical complex had a total of 15,059 ward admissions and 15,062 discharges for the reporting period, with a 12% increase in both admissions and discharges in 2023 when compared to fiscal 2022. The outpatient clinics at the St. James Medical Complex under the Cancer Center of Trinidad and Tobago, which is niched in oncology care, saw a 7% increase in utilization in total visits from 45,775 in fiscal 2022 to 48,851 visits in fiscal 2023. There was an increase in clinic visits in all areas except gerontology clinic. Oncology services continue to be a significant area of focus for the NWRHA. In 2020, the NWRHA launched its Linear Accelerator, or LINAC, at the Cancer Center of Trinidad and Tobago, located at St. James Medical Complex. The LINAC was heralded as the first of its kind in the public healthcare system for the English-speaking Caribbean, with key identified benefits including the improved precision and efficiency of radiation therapy and the increase in availability of radiation treatment for patients. During the reporting period, the NWRHA sought to optimize the utilization of the LINAC at the Cancer Center through the increase of specialist staff for the facility, as well as the expansion of ICT support systems. From its inception in 2020 to the end of 2023, there has been a 140% increase in the number of patients being treated on the LINAC. Additionally, there has been a reduction in wait times for patient treatments from 10 weeks in fiscal 2022 to 8 weeks in fiscal 2023. The NWRHA intends to continue to optimize the LINAC services to further increase patient treatments. Additional activities that are being undertaken to improve the delivery of oncology services include: 1, the modification of the clinical management structure at the St. James Medical Complex. This would include a dedicated medical director and service coordinator for the facilitation of oncology services at the facility. 2, the continued recruitment of specialist staff for oncology services. It should be noted that recruitment activities for these positions continue into fiscal 2024. The introduction of short-stay Saturdays. This would increase the provision of chemotherapy treatments through admissions for service on weekends between the hours of 8 a.m. and 2 p.m. The NWRHA intends to expand its initiatives geared at early cancer detection and screening for cancer. These include increased health promotion through health screening and health education for cancer. The NWRHA conducted a study examining the link between diet and exercise and cancer. And the findings of this study resulted in the development of the Cancer Beyond the Hospital research proposal. This will be implemented to bring cancer screening and education to several communities within the Northwest region. And secondly, the introduction of a men's health clinic. This will assist in cancer screening, surgical intervention, raising awareness, and providing cancer-related services for men specifically. So thank you, CEO. Back to you.
Thanks very much, Keisha. So as we move forward with the presentation, if I could just find my slide, we'll be moving forward. Yes. So we're going into our area, our second key strategic area, which is prevention, treatment, and care of communicable diseases. And the prevention, treatment, and care of these diseases continue to be at the forefront of healthcare efforts at the Northwest Regional Health Authority. The fight against HIV/AIDS, for example, endeavors for persons to be aware of their status, receive much-needed treatment where determined positive, and really make efforts to suppress the virus. If we look at some statistics over the period under review where HIV testing is concerned, you'd see that the Northwest Regional Health Authority has made significant efforts again to destigmatize HIV and AIDS and to really provide avenues for testing, treatment, and counseling. So we have several full-time sites, 12 roving sites, and 3 extended hour sites where HIV testing can be made available. And this is part of a drive from the Ministry of Health to make sure that HIV testing is available throughout the country and that persons avail themselves of the opportunity to so do. Some more statistics in terms of HIV testing, you'd see that the provision of spaces for testing means that people have really come out and avail themselves in the last 2 financial years, and over 12,000 persons would have been tested through the efforts of the Northwest Regional Health Authority, with 128 positives. And obviously, when persons are found to be positive, they are referred and put in a care pathway that allows us to immediately identify, treat, and provide the counseling and the support that persons need. Let's talk now about our World AIDS Day campaign, because what we try to do is align our outreaches to our strategic objectives. So we would have said earlier that we would have celebrated a number of international health observances, and this is something that the NWRHA prides itself on. World AIDS Day aims to bring awareness of factors contributing to HIV/AIDS, reducing stigmatizations of persons living with HIV/AIDS, and promoting equal access to healthcare services such as testing and treatment. NWRHA would have hosted its World AIDS Day event at the Brian Lara Promenade on the 1st of December 2022 in the culmination, and it was the culmination of a month-long of events, which including an HIV testing campaign. Free HIV screening was done in conjunction with basic health screening and other developmental services provided by the health promotions team and its external partners. A total of 251 persons were tested on the Brian Lara Promenade that day, and that in itself is again an achievement. Could you think about many years ago, persons testing for HIV/AIDS on the Brian Lara Promenade? That is destigmatization for your money. I appreciate you for that. Peer education, youth information service, HIV/AIDS, sexually transmitted infection education. This is extremely important. Our peer education service is a youth information service originally focused on educating the youth on sexually transmitted infections, including HIV/AIDS. With time, our peer education services have had to expand from just looking at youths to now educating entire communities about HIV and AIDS, and a total of 240 educational sessions were conducted with a total of over 5,000 persons being reached during the reporting period. So we're really going out there into the communities and ensuring that persons hear the message and they understand what they need to do to prevent themselves. And if by chance you do get tested, and as I said, you do turn up positive, we are allowing people to understand that this is not a death sentence, that persons can live with HIV and AIDS, and that the treatment is available in the public healthcare system. We've touched on this and spoken about it several times in the presentation so far, but it would be remiss of me if I didn't put a section in this presentation to deal specifically with COVID-19. You'd have heard the chairman speak to the efforts of our former CEO, Ms. Batch, in terms of her leadership during COVID-19, and I want to also congratulate, as the chairman did, her and the executive team during that time. But this happened during the reporting period, and it is important that we reflect on the successes and the endeavors during that period. It was a very difficult time for staff and our internal and external stakeholders, but the NWRHA persevered, pushed through, and the successes of COVID-19 for NWRHA is testament to the commitment and the dedication of all our clinical and ancillary staff. So on March the 12th, 2020, Trinidad and Tobago saw its first case of COVID-19, and life changed forever for healthcare professionals on that day. With time, a new normal emerged, and the NWRHA involved to meet the changing demands of the healthcare system. With the onset of COVID-19, the Trinidad and Tobago, the public healthcare system was required to adapt its mode of operation, including social distancing, IPC practices, retrofitting of existing facilities, and the creation of new facilities to ensure effective patient management and safety. As an essential service, the NWRHA was actively engaged and supported the country's efforts to manage the COVID-19 pandemic. The staff of the Northwest Regional Health Authority worked tirelessly, I say that again, worked tirelessly to operationalize the parallel healthcare system while ensuring that the conventional healthcare system did not drop the ball. As time progressed, the authority again mobilized to execute COVID-19 vaccination campaigns. So it started with the creation of the facilities, and then it moved into a mode where thousands of persons needed to be vaccinated. And again, the Northwest Regional Health Authority rose to the occasion, setting up several vaccination sites across our demographic, and really, as I said, rising to the occasion where needed. Let's look at some of the facilities that were actually put together to support the pandemic drive, the parallel healthcare system. And during the COVID-19 pandemic, the NWRHA operationalized the following parallel healthcare facilities: the Princess Elizabeth Home, the National Academy for Performing Arts Hotel, the COVID-19 Field Unit, and I want to say again, the COVID-19 Field Unit, which was the first of its kind, not only in Trinidad, but from my knowledge, the first of its kind in the Caribbean, which was essentially a tent city set up in Jean Pierre Complex. And I want to say my personal experience with that was that that facility was set up in a couple of days, and the doctors, nurses, and ancillary staff went into those tents and cared for COVID-19 patients for months and did not complain and performed their duty as they are understood to have taken an oath to do, and I really salute them for that. Other facilities were created at the back of the Port of Spain A&E, our COVID-19 prefab facility there, affectionately known as the Dolly House at the Port of Spain General Hospital. We also would have done several refurbishments at the Costat and Maternity Department to ensure that we manage COVID-19 patients in those departments. The St. Anne's Hospital also saw 2 wards being refurbished to cater for COVID-19 patients at the St. Anne's Hospital. And obviously, screening tents were erected not only in Northwest but across the country at our primary care health facilities and at the Accident and Emergency Department to facilitate a parallel pathway for persons emitting COVID-19 symptoms and so on. Let's talk now about our COVID-19 vaccine drive, which for me and a lot of members of staff required what I called shoulders to the wheel. During this time, there was no what you call working hours. COVID didn't have something called working hours. COVID was 24/0, as the young people say, 48/14, right? You're on call right through all the time. And although there was some hesitancy regarding vaccination, the public and staff responded positively towards the vaccination efforts. Training was conducted for nurses, doctors, and other categories of staff qualified to administer vaccines. As at September 30th, 2023, the authority would have administered a total of 290,828 vaccines. If you think about the process to go into a vaccination site and get a vaccine, 200,000, close to 300,000 is no small effort in that regard. the NWRHA implemented 3 main strategies in support of COVID-19 vaccination. One, mass vaccination sites, which were located at the Savannah, at the National Stadium, Hasely Crawford Stadium, at the Defense Force Heliport Base. We also had a number of vaccination outreach initiatives, which included home shut-in visits, vaccination drives for young persons at the Costad City campus, which we did for students, and vaccination in public places, as I said before, in the malls and PTSC and wherever we found that there were masses of people being. Health centers also had an express program for the elderly. And you know, at the start of our vaccination program, we tried as best as possible to facilitate the elderly in that regard at our health centers. What were some of the COVID-19 measures that we had to implement at the NWRHA to ensure that we had a parallel health system and that the normal passage of healthcare was not being adversely affected? And we would have implemented a block appointment system, which ensured that there was not overcrowding in our clinics at the hospital and health centers and so on. Teleconsultations were also established, and our telemedicine would have gone a long way in terms of assisting persons during that time, getting their consultations with the nurses and doctors and so on. A lot of IPC training for the staff, and you know, through that IPC training, I think the IPC department at Northwest Regional Health Authority has developed leaps and bounds over that point, over that period that we had to be engaged with COVID, because IPC became so much relevant during that period of time. Mass casualty management training also, and sensitization sessions and daily reporting systems were operationalized to support real-time decision-making and critical management. Additionally, we would have strengthened the occupational health unit at the Northwest Regional Health Authority, because we realized that staff matters. And in the very first slide, I talked about the staff being the key asset at the Northwest Regional Health Authority, and we've made significant efforts in terms of strengthening not only that unit, but also strengthening the employee assistance program, support for staff that Chairman would have spoken about. We also established a long COVID clinic for persons that continue after being inflicted with COVID, continue to emit long-term symptoms and so on, and that has also been a success coming out of COVID. Next, we want to speak a little bit about our influenza vaccine drive over the period under review, and more than 10,000 persons would have benefited from this drive. I want to say to persons that influenza is here, and coincidentally, the Northwest Regional Health Authority is currently undertaking influenza vaccine drive through the GM Primary Care, GM Nursing. We currently have persons in the malls. We had persons this week and last week at City Gate. We had persons doing vaccination at City Hall, and I really want to ask all of you present here and online to get your influenza vaccine. Influenza can cause death, and you need to have your vaccination done yearly. Avail yourself of the opportunities. All the primary care facilities, not only in the Northwest, but across the entire Trinidad and Tobago, provides vaccines at this time, and I urge you to go out there and get your vaccine. We now look at our third priority area, which is maternal and child health, and the NWRHA shares, obviously, in the Ministry of Health's commitment to improving maternal outcomes across the country for both mother and child. Maternal and child health remains a key focus area for the Northwest Regional Health Authority, and we are poised for long-term planning and incremental developmental increase in this area. And if we look at some statistics in terms of our maternity department at the Port of Spain General Hospital, we have been able to come leaps and bounds in the last few financial years, and I think the numbers speak for themselves in terms of the quality of care that is provided at the maternity department at the Port of Spain General Hospital. There has been a gradual decline in births, as you can see from the figure from financial year 2021 to 2023, but it is important to note that maternal deaths stood at 1 in financial year 2021, and in 2022, 0. I'll take a big applause for that. Antenatal classes continued for mothers and partners. Childbirth classes commenced at the Pitti Valley Health Center with a total of 278 mothers attending for the period. Presently, there are childbirth classes offered at 2 health centers in each county, and obviously as part of our strategic priority, we intend to extend that as we move forward. This is also very important to the Northwest Regional Health Authority. It's our baby-friendly hospital initiative, and the baby-friendly hospital initiative is an effort of UNICEF and the World Health Organization to ensure that all maternity departments become centers of breastfeeding support. A maternity facility can be designated baby-friendly when it implements steps to support successful breastfeeding. An internal assessment was conducted in 2023, and the authority has looked at the gaps to us receiving that baby-friendly initiative accreditation, and we will be inspected shortly within the next quarter, and it is expected that we will receive that accreditation. I am on that, like, as the young people say, white on rice, and I will ensure that we get the accreditation needed in that regard. Ms. Fernandez, Administrator at Port of Spain General Hospital, yes? Thank you. The next area for consideration is our health human resource planning, and I want to take my water break now and ask Ms. Goodridge, our GM Human Resource, to assist me in this regard.
Good afternoon all again. Thank you, CEO. So it has been a pervasive theme for us this afternoon about the importance of the employee. And with that in mind, we look at training. Sure. Thank you. Yes. We look at training, as I said. Training is intended, in most instances, to improve employee performance. In that regard, for the period, we have trained approximately 8,805 employees, 8,374 in internal programs, 424 in external programs, and 7 in overseas programs. Of course, the efforts of training are further emphasized by the fact that we have signed a memorandum of agreement with the University of Trinidad and Tobago to ensure that our staff, our managerial staff and leadership staff, are trained in courses on leadership and management. We have sponsored as well 35 employees and have certified them in the District Health Visitor Training Program. In addition to which, we have had several collaborations, some of which I can list: National Energy Skills Program, the Ministry of Health, Ministry of Labor, as well as PAHO. Training has also been offered in a variety of specializations within the authority: infection prevention and control, customer service, supply chain management, HIV and AIDS, specialized nursing programs, to name a few. So this totally reemphasizes the fact that the authority continues to remain committed to the employee empowerment and the employee training. Employee support. The Employee Assistance Program, also known as the EAP program, has provided during the period and continues to provide psychosocial intervention for employees. This is seen in the areas of anxiety, stress and depression, burnout, personal and domestic challenges, workplace issues, work-life balance, retirement, anger management, as well as bereavement programs. For the reporting period, a total of 2,263 calls were made to our Employee Assistance Program. Not forgetting our male folk, the Employee Assistance Program as well also engages in male or men's support program. This initiative saw, thus far within the period, 2 cohorts. In today's economic climate, it is certainly very critical and important that the person's employees have the tools necessary to balance their finances. So, financial planning and management was also a key component. In the area of employee engagement, and I know CEO and Chairman would have made reference to the employee and having the employee engaged, on the 10th of August 2023, the children of the employees who wrote the SCA exams, they were recognized for their achievements. For the first time, this exercise took place, and a total of 31 children were rewarded. The authority, thank you. On July 16th, following through with employee engagement, we held a sports and family day, of which all 6 institutions partook in it. Additionally, prior to this sports and family day, we also had cricket and football competitions. Thank you.
Thanks very much, Gillian. So, as we move to our 5th area, as we come very close to the end of the presentation, we'll look now at patient care, customer service, and consistent with the core values mission of the Northwest Regional Health Authority, we endeavor to be a patient-centered organization. And in this regard, patient care and customer service have been included as a strategic priority for the authority. Within the Northwest Regional Health Authority, a total quality management approach is utilized, which focuses on the areas of performance, best practice, health, and data analytics, monitoring and leadership assessment of patient safety measures, improvement of health outcomes, and accreditation readiness. In terms of customer service, the graphic that you see above shows internal and external complaints that would have been picked up by our quality department. What we have the quality department do, we have a phone line, a hotline. We also have a hotline on the NWRHA vehicles. If you look at any NWRHA vehicle, it's branded. It also has a number that you can call the quality department to make complaints, from as simple as how am I driving. There's also an internal mechanism that staff can use to make complaints and so on. The resolution rates above 61 and 68% respectively, and obviously we want to push in the new financial year to have a greater degree of resolution in that regard. Some of the quality initiatives that we've looked at to improve the level of service that we provide both to external and internal customers include 31% reduction in chemotherapy waiting times. That's what our initiatives have resulted in. 11% reduction in consultant waiting times, increased laboratory hours, and mandatory customer service training and risk management training. Yeah. We next look at our next core area, which is health infrastructure and facility management. And this area is extremely large, but for the sake of time, I will not go through all the projects and achievements that we have had from our projects and facilities department. But safe to say, we've undertaken several projects in both the facilities and projects department. I'll just highlight a couple of them. For instance, major medical equipment. We've installed new CT, digital X-ray. We've installed mammography, a new mammography machine, infusion pumps, syringe pumps, and so on. We've completed renovations at the Costa Beco building, commissioned new equipment at the Port of Spain General Hospital. We've refurbished the blood bank. That is a significant refurbishment project for us, and completed a number of projects, including electrical works, upgrades in line with infrastructure that is required for the commissioning of the central block. some other refurbishments that have taken place and been completed over the last financial year include the relocation of the pure water system at the central block, the relocation of the water supply system, and the relocation of IT infrastructure to facilitate the construction of the central block. At the St. Anne's Hospital, we've also had wards at number 9, number 16, and number 17 refurbished. We've had the construction of a new engineering building at the St. Anne's Hospital and the refurbishment of the front hall at St. Anne's. We've completed construction renovations at we have the new Diego Martin Health Center that was opened, and we've commissioned new generators throughout the primary care landscape in Northwest. We've also completed renovations at the Las Cuevas and Petite Valley facility and completed minor renovations, including things like electrical, plumbing, and ACs at most of our primary care facilities across the Northwest Regional Health Authority. Some of the key ongoing projects that we have is the water recirculation problem at the St. Anne's Hospital. We are solving that problem. We are at an advanced stage of delivery of that project. There are 2 phases in the project. One is the water distribution system, which we call the water reticulation, and the next is the storage, right? And we are at an advanced stage in terms of delivery and expect that project to be completed this year. We spoke already about the electrical upgrade works at St. James to facilitate the MRI, and electrical upgrade works also at the Port of Spain General Hospital to facilitate the commissioning of the central block. We also have consultancy services ongoing for the expansion of the Accident and Emergency Department, and we know that the Accident and Emergency has to be expanded to facilitate the new intake at the central block. We also have consultancy services ongoing, which is at an advanced stage for the refurbishment of the kitchen at Port of Spain General Hospital, because to cater for the additional 540 beds and the expanded patient load, obviously the kitchen needs to increase its capacity in that regard. We next move on to one of the final areas, which is a modern health information system. And the chairman would have covered a lot of the information here, but needless to say, our health information system, not to be repetitive, is second to none in Trinidad and Tobago, and the intention is to have that expanded into the new central block. We are at the stage now that we've expanded it into all of our healthcare facilities, the pharmacy module. We've expanded a lot of the modules into the Port of Spain, St. Anne's and St. James facility. There's a lot of testing and commissioning now, and we're working with our partners at NFT to have this system refined, so when we operationalize the central block, we will have what I would call not a foolproof system, but a system that works well for us. I want to just move to an example of one of our dashboards here. This is a product of our health information system, and as we said, we are a data-driven authority, and our health information dashboards allow us to make critical decisions and to divert funds in the way that we need to. The dashboards help us look at things like utilization of our clinics across the RHA. It helps us to look at which pharmaceuticals are heavily used in the RHA, which pharmaceuticals are expiring soon, and it helps us to move resources around, and in the end of the day, it gives us value for money by using data to make decisions. I will now, we have 2 slides that Ms. Solange Maynard, our acting GM Finance, will speak very quickly on the financial performance of the RHA over the past 2 years.
Good afternoon, all. This financial report will cover fiscal periods 2022, which is October 1st, 2021 to September 2022, and fiscal period 2023, which is October 1st, 2022 to September 2023. This presentation provides an overview of the authority's financial summary during the reported period. It will cover 4 key areas. Capital expenditure, which is referred to as PSIP. We will look at allocation and spend, as well as COVID-19 expenditure, and lastly, operational expenditure. With reference to capital expenditure allocation, when comparing fiscal year 2022 to 2023, it is broken down into three main categories. Medical equipment, when comparing the two fiscal periods, there was a 29% decrease in terms of allocation. With reference to hospital refurbishment, there was a 54% decrease in terms of allocation when comparing fiscal 22 to 23. And with reference to physical investment, allocation increased by 25% when comparing 23 to 22. Overall, capital expenditure allocation decreased by 28% when comparing fiscal 23 to fiscal 22. With reference to spend, when looking at the two main areas comparing fiscal 2022 to 2023, you can see that there was 100% spend in terms of what we received, what we spent for fiscal 2022, and for fiscal 2023, we would have spent 69% of what we received. When looking at COVID-19 expenditure for fiscal period 2022, 73% went to human resources, 21% went to consumables, 5% went to infrastructure, and 1% pertained to equipment. There was no COVID-19 expenditure for fiscal year 2023. And lastly, when looking at operational expenditure for the two fiscal periods, there was a 2% increase when comparing fiscal 2022 to fiscal 2023. Thank you.
Thanks very much. Nice blue folder. Forget here. So as we move along in the presentation, we come to the final and one of the most important areas of interest for the Northwest Regional Health Authority and the community that we serve. And of course, we could not come here today without giving an update on the progress of the redevelopment of the new central block of the Port of Spain General Hospital. And as we said earlier, the Port of Spain General Hospital was established in 1855, and I don't want that to get lost on you all because there is infrastructure in Port of Spain General Hospital that is more than 100 years old. Yeah, let us not have that lost on us. And while we try to preserve the architectural and historical value of the Port of Spain General Hospital, we also have to be cognizant of the fact that we're trying to integrate very old infrastructure with new. The present health service capacity, as we said before, 16 wards and 9 clinical departments. The present utilization is about 120,000 unique patients, and the NWRHA's catchment, as we said earlier, is approximately 500,000 persons, both resident and commuting. The present bed capacity, 236 beds. What are the major deliverables of the new central block? And just to reiterate, teaching hospital status, new and expanding services, which I will shortly highlight, increased bed capacity, 540 beds, and increased staff complement, which will be done obviously on a phased basis. What are some of the new services that will be coming to the Port of Spain General Hospital? Feature of the new hospital will be pediatric care, catheterization and coronary care, and psychiatric care. And psychiatric care because we're not only seeking to decentralize mental health in the other parts of Trinidad and Tobago, but also in this authority. The mandate of the Ministry of Health is that every major hospital will have some psychiatric outpatient services. Some expanded services will include an expansion of our accident and emergency, expansion of surgical care with 10 new operating theaters coming to the Port of Spain General Hospital, and expansion of diagnostic and clinical support at the Northwest Regional Health Authority and the Port of Spain General Hospital. What is the strategy on behalf of the Northwest Regional Health Authority to commission and operate this facility? So we're going to have a phased human resource recruitment of qualified and certified individuals for clinical, allied health management, and technical support positions. Policy development is number 2, and this will facilitate effective governance and accountability. Number 3, procurement of equipment in areas such as ICT, security, and biomed. You see, this commissioning is twofold. A large part of the project is being undertaken in terms of the physical building infrastructure by UDCOT. So UDCOT will build and commission the building infrastructure along with a lot of the major equipment that goes into the building, the biomed equipment and so on. The Northwest Regional Health Authority will ensure that the building is staffed, that there's adequate maintenance that goes along with that building, and that we also provide the ICT equipment through proper public tendering and so on to outfit this building. Retooling and training and development of existing NWRHA staff. This will be a modern healthcare facility. A lot of the job families that you currently have at the Northwest Regional Health Authority may not be needed at the new facility, and it means that we have to continuously meet with our staff, speak to them about training opportunities, speak to them about retooling so that they can fit into the new plans for the Port of Spain General Hospital. And obviously, part of the plan must be to work with Solange and her team at finance to ensure that the finance is available, that we have proper estimates and so on, so that, well, Solange and her team has to prepare. And we hope the auspicious Minister of Finance will assist us in that regard. We now will speak very shortly about the construction process, the progress of the construction. And this project was conceptualized in December 2019. The project actually started in terms of groundbreaking in June 2022, and the estimated completion is 2025. And we expect to commission and be in that building, operating it in 2025. In closing, I would like to state that the reopening of our inpatient services and the re-engagement with the public after the COVID-19 pandemic proved to be the defining moment for the authority during the both financial years, and the commencement of a new period for public health care in Trinidad and Tobago, filled with its own unique challenges, experiences, and accomplishments. These accomplishments have been attained due to the hard work and dedication of our employees, who we are eternally grateful for. We at the authority wish to thank our entire board of directors, our chairman, Ms. Lisa Agard, for her stellar leadership exhibited during the reporting period, of course. I beg you. Thank you for being an attentive audience this afternoon. I encourage you to continue to partner with the authority as we seek to provide optimal care to our patients and increase the overall well-being of the citizens of Trinidad and Tobago. Thank you very much.
Thank you, CEO. Thank you, Dr. Gangaram. Thank you, Ms. Goodrich. Thank you, Ms. Maynard, for your comprehensive overview of the authority's achievements and activities for the reporting period. We have now come to the question and answer segment. We have a hot 30 minutes. All right, so this is what we're going to do. We know we have limited time, so we have set up some mechanisms to support this process. We have a quality booth at the back that will answer any further questions you have with regards to client services and patient concerns. We also have an HR booth set up that will respond to any individual staff concerns and IR concerns you may have. Now, I want you to triage your questions, right, Mr. Stewart? Choose the most pressing questions. And in the first instance, we will take one question per person. We have a number of questions that have been submitted online from our online platform. And I will start CEO with some of the questions online. So Ms. Romeo Bassi would like to know, when the new central block is completed, how long before it will be outfitted with equipment, beds, etc.? What is the bed state of the new central block? No, that's not one. You want to come here? You could come up here in the meantime. Yeah, as we. Oh.
I think it's working now. Right, so let me see if I can remember the two questions. Keisha, the first one dealt with the construction of the new central block and when would beds, equipment, and so on be available. So I'm pleased to let our online person know that the scope of services to be provided in central block and the scope in terms of infrastructure to be delivered includes beds and all infrastructure that goes in. So once central block is completed, it will be totally refurbished. Project completion not only means the infrastructure in place, but also all the equipment that goes along with that infrastructure. I feel the two mics. Could you repeat the second question?
The bed state.
Say again?
The bed state, the amount of beds. It was mentioned in the presentation.
So I think we covered that in the presentation on several occasions, but the new patient tower will contain 540 additional beds.
Does anybody of our in-person audience have any questions? Please make your way to the mic or raise your hand.
I'm just wondering how many people work with the Northwest Regional Health Authority total? Sorry.
In total. The Northwest Regional Health Authority has approximately 5,000 employees.
Okay, Mr. Gilchrist?
I just have a comment first for the presentation by the CEO, which I thought was very informative, especially on the issue of the primary care division. Because usually a presentation is done with a lot of talk about hospitals. But I just wanted to ask, I didn't hear anything about dental services. Just
Sure.
dental services. And
Yep.
just a little bit, someone told me I may have to have cataract surgery just now. And I was just concerned about the backlog to some degree. And finally, I noticed you said that there's a decrease in allocation. And I was a little bit concerned about the rising cost of healthcare in the midst of a decreased allocation. So I was so concerned about whether or not we might be there's an issue with respect to how do we raise additional resources to meet the rising costs, especially after COVID. We noticed an exponential increase. So I was concerned about that.
Sure.
Okay.
So I think Mr. Gilchrist had 3 questions and there's 1 question there. Right. So I wrote it down, so we'll get to it. So in terms of dental services, the authority is aware of the need for dental services. I often tell a story when I meet with the DHVs and the persons in the community. Having grown up in MOVA, I was a product of the primary care facilities when persons would take you for immunization to the health center and take you. My first interaction with a dentist was at the MOVA Health Center. So I know the importance of it, and I also know that dental care is very expensive. So we need to ensure that the most vulnerable persons in society have the opportunity to have dental care. So we do have a number of our primary care facilities with dental suites, the Marval Health Center, Diego Martin, Sawa, etc. What we've been doing for some time now is asking the Ministry of Health to transfer the dentists from the Ministry of Health to the Northwest Regional Health Authority. The ministry provides us with dentists on a rotationary basis, and we are in the process working with the Ministry of Health on that. The Northwest Regional Health Authority, through our board, would have expended significant amount of monies to upgrade our dental suites, and in fact we are installing a new dental suite at the Sawa Health Facility now, which should actually be almost 90% completed. So we do realize, Mr. Gilchrist, the need for dental care and have shifted resources in that regard there. The second question, I think, deals with allocation. Cataract surgery. Sure. So my chairman wants to. She will deal with allocation. Right. So in terms of cataract surgery, I think you asked two questions there, but with the first one, I wouldn't be able to tell you if you'll need surgery, because I think he was saying that he may need surgery, so I wouldn't be able to help him with that. But he can avail himself of the clinic, right? As you would know, Mr. Gilchrist, being an employee, the eye clinic at the St. James Medical Complex is highly subscribed. We have some of the best eye surgeons, cataract surgeons in the country, but it is heavily subscribed. We're currently working on a tender for some additional equipment, joint tender with all the RHAs that my fellow RHA CEO can testify to. So we're actually going to increase the availability of technology, and that technology will help us reduce the backlogs and waiting times and so on. A feature of the new central block, which is to come within the next financial year, is an increased amount of operating theaters. And as you know, also operating theater time is really a rate limiting factor in terms of how soon people can get their operations. But with 10 new operating theaters coming, you will have dedicated operating theaters for eye surgery in the Port of Spain demographic coming. So there is good news, and I'm sure between now and next year, you're not going to lose your sight, Mr. Gilchrist. The last one, I think my chairman wants to speak on the application.
Sure. That's a very astute observation, Mr. Gilchrist, in relation to the reduction in the allocation of spend between fiscal years. So, managing the finances of any public institution is a continuous challenge in Trinidad and Tobago, having regard to the economic environment in which we operate. It is no secret that out of the monthly allocation, typically about 75 or 80% goes to pay salaries and wages and other allowances. So what we have done, however, in relation to the central block, we have prepared a separate budget to cover all of the additional human resources we require, as well as the maintenance of all of the equipment, etc. And we have submitted a separate budget to the Ministry of Health so that when the central block comes online in 2025, we remain hopeful that a substantial part of the budget that we have submitted for that facility will in fact get approved. And just one final point in relation to the presentation in relation to finances made. None of those projects outlined in there include expenditure for the central block. That is being covered directly by UDCOT pursuant to its financing arrangements through Cabinet and the Ministry of Finance. Just wanted to make that point because it costs a whole lot more than 18 million that you would have seen us cover in the PSIP project.
Thank you, Chair.
Thanks
We'll
very
take
much,
a question from online. CEO, how does the organization monitor and evaluate the quality of healthcare services it provides? And this is from a Ms. Critchlow.
That's an excellent question from Ms. Critchlow. The easy answer to that is through its quality department. Right, the quality department, and I will ask the manager quality to come up and just speak about some of the initiatives that we have put on board to ensure that the quality of healthcare is monitored through performance indicators, through international best practice and standards and so on.
Good evening, everyone, and thank you for the opportunity to share with you what we at the NWRHA are doing towards assessing the quality of our healthcare services. Currently, we have the client feedback system where our customers can come and provide complaints, commendations, suggestions, as well as recommendations to improve our services. We also conduct assessments, time and motion studies, satisfaction surveys, and excuse me, satisfaction surveys, and also look at audits where we look at compliance with local, regional, and international standards. We also look at our clinical protocols, and on the floor, we assess our processes and do process re-engineering and monitor the impact of these process re-engineering. And from a regional perspective, we have committees like the quality circles, radiation assurance committees, forgive me. No water left in the back. IPC and drug committees. And from the board subcommittee level, we have the quality committee, where we all look at data and assess how we can improve the services to our customers.
Thank you very much. Do we have any other questions from our... Well, this is your second question, or final question.
I had no idea we were so limited.
Thank you.
I did miss the opportunity to thank you very much for the presentation today. On behalf of the Chamber of Commerce, I think that it was an excellent presentation, and it gives people an understanding of what's taking place behind the doors of the Northwest Regional Health Authority. So congratulations on that. My question earlier, which was about the number of people that you employ, was really directed in the idea of how you use your staff, utilization of the staff. And it's quite impressive to see the growth that you all have been providing to the public over the years. And that's just 2 short years that you have been in this that we're looking at today. And I commend you on that. You mentioned, however, one of the things, and this is not a but, this is still a positive. One of the things that we're looking at was the blood bank, and you were talking about the refurbishment of the blood bank. I and the country would like to look for additional donors for blood because it's a very necessary part of our lives. And I was wondering, where has it been moved to, or is it in the same location? Could you give a little rundown of that?
So
and
sure,
promote
excellent
it?
question, because I think this is something that we have been pushing at the NWRHA and at all the sister and brother RHAs in terms of that expansion of the community that donates blood, and especially we're pushing non-remunerated blood donation. So to answer your question, the blood donation area is in the same place. It's on the compound, it's right next to Holy Name Convent. Just before the Holy Name Convent gate, that single-story building that you see there is the blood donation center. What you do, you're driving through the maternity department, you're making a U-turn and coming back out of the facility, and when you almost exit that facility, there's a parking lot there that we cater for you.
So it's in the same new location?
Yes. What we did is to... no, not the original.
Not the original.
Yeah.
Okay, thank you. We'll take another question online. With the push for TT moves and for movement, Ms. Lyda Johnson wants to know, CEO, why can we not get a gym for staff at the Port of Spain General Hospital?
Yes, excellent question. And I see, it seems that Ms. Johnson has her supporters in the audience. This is one thing we didn't ask for a clap for. So I want to say, again, an excellent question, and I want to also say to the staff that you're pushing an open door where that is concerned. A proposal has been submitted and accepted by the Board of Directors for a multi-purpose building that is in support of the Central Block of Port of Spain. The proposal has also been accepted by the Ministry of Health in that proposal, it contains a staff gym. It not only contains a staff gym, but it contains a babysitting center for mothers there and so on, and ancillary facilities for staff.
Thank you.
Your rag fall, Mr.
Thank you, Mr. Stewart.
A pleasant good evening all. I will be brief, but I just beg your indulgence so I could just get through a couple points, yeah? One is for finance. I was looking through the Auditor General report on public accounts for 2022, and I noticed points 6.94 and 6.95 spoke to Northwest not adhering to its procurement policies in terms of having 3 quotations in respect to 24 purchases totaling 2.4 million. And then they went on in 6.9 speaking about another something similar, payments of totaling 2.4 excess were made to 11 suppliers who were not on the authority's list of registered suppliers. So just wanted to get a little feedback on that. And I just want to say congrats on Northwest. This is my RHA. I'm still an employee. I hope I still have a work after this presentation. Point 2, you know, every board meeting I go, I always hear about strengthening primary health care, but the focus is more or less what has been displayed here, more screenings and all of that. But it doesn't focus on actually tracking persons through their life cycle to keep them healthy. It always almost like a roadblock. So we catch you in a health fair, we catch you in a church or something, we do some screenings. Okay, you're good, you could go on your own now. And then we don't catch you until we catch you 4 years after. As opposed to, just as we do with children, and that is why we, in the Caribbean, we are one of the highest in terms of vaccination rate. We continue, we give them a timeline to come back to the facility where we could check on you. But after 5 years, we throw them out of the door and we don't see them until they get back unhealthy. So I really hope that could be changed going forward. So the end result of that, I just want to know, what is Northwest's view on healthcare? Is it that they see healthcare as something that we will interact you only when you get ill, or we actually going to maintain your health? Yeah, that is my kind of pet peeve with all these public board meetings. Because when you watch the statistics in every single board meeting I go shows a continuous upward trend in diabetes and amputations and every communicable disease. So the statistics is actually indicating we are failing, and WHO would have recently exemplified that worldwide for the world to see that we are failing. And 3, I have 6 points, but I'll stop at 3 and then come back if I'm permitted. 3, I just want to confirm it is Northwest's position, and particularly the chairman, because I know the CEO is aware, it is the chairman's and the board's position to deliberately and vigorously block RMU status of unions within Northwest, as letter dated the 23rd of June 2023, sent to the Registration, Recognition and Certification Board. If it is the position, should the board inform all of the employees that this is their position to block RMU status of unions within their facility? Yes, because so I'll pause there for now. I'll come back.
So thanks very much for your, I think it's 4 questions, but I will attempt to, how should I say, inform you of same. So the first question dealt with 24 purchases in the report and so on. While I don't know, I can't say offhand what the specific purchases are, from my memory, a lot of these purchases had to do with expenditure during COVID-19. COVID-19 was a very difficult time for most public sector entities. And because of government regulations, most suppliers were actually closed. If you remember the regulations, they would have said all non-essential suppliers had to close their business. But the health authority had to continue to function. So for example, we spoke about vaccination sites having to be set up, drive-thrus, hospitals having to get additional tents, services that we would not normally, in the context of an hospital, have to procure. And when you have an instruction, for instance, to set up a temporary hospital in 48 hours, at that point in time, when you're looking at persons dying under a tent in an A&E and us not having space to put them, we as an executive have to make a decision what is most important at that point in time. Is it the care and management of the patient, or is it looking through the listing to see if you find somebody at the point in time? We have had these conversations with the persons from the Auditor General Office, and the staff at the NWRHA will always err on the side of saving lives, because that is what is most important to us. In terms of primary health care and the follow-through life cycle, you would have heard the chairman speak extensively on our health information system and the e-health app. In terms of tracking a patient from nursery to tertiary and adulthood, that is what the app allows us to do. When you register on the app from a young stage, all your health information stays with us. What you have now is a manual system where somebody has a file in Maracas, they have a file in Port of Spain. If they go San Fernando, they have a file. Once we have that unique system and the entire RHA is connected with that, we have your health profile for life. So when you present 10 years down the road at a hospital, immediately the doctor could pull up an iPad and say, well, wait now, Edie, you haven't been to clinic. We've recommended that you come to clinics. You haven't been to rehab. You haven't. So you can actually track the patient from nursery to tertiary. We continue with our health education programs, and we spoke about it in the presentation in terms of engaging persons in the preventative maintenance part of healthcare. So we are engaging at the primary level. We have something also called a health passport. That is a feature of our primary care outreaches, that in that passport, we put all the information necessary to register a patient, and that information now goes into our health information repository, and we build a profile of that patient from the time they enter straight through. So as the chairman says, as we develop a more robust system, as we continue to invest in our health information system, that is what is going to give us the ability to carry it through the patient lifestyle.
So, Mr. Short, I'm so glad you asked that question about tracking the life cycle of a person, and Major Blake explained the health information management system. It not only collects the data, it produces very important dashboards from which we obtain critical information that enables us to make decisions. I'll tell you one thing that stuck out with me in looking and reviewing the data produced at the Cancer Center in St. James, which speaks to the point that you're making. You know that approximately 75 to 80% of the people who present at the Cancer Center in St. James present at stage 3 and stage 4. What does that tell you? It's too late. And so therefore, what that data gives us insight into is the fact that we need to do more preventative action before it gets to that stage. So by having the ability with the unique identifier in the platform to track a patient through their entire life cycle and interaction with the RHA, we can be proactive in terms of how we treat with a patient's health throughout their life. But we have to have, I tell you, that is why digitalization is so important in this new construct. Otherwise, relying on manual systems and pulling data manually is really not going to take us anywhere. And then, your last question, let me give you the assurance, Mr. Stewart, that neither this chairman or anyone at the board level is blocking the recognition of RMUs. But in this regard, I think it's Justin here? Justin, yes. Perhaps you can provide some insight or provide some explanation to Mr. Stewart, because for some reason he thinks to be of the view that the board is blocking RMU recognition for unions in the NWRHA.
Good afternoon, everybody. My position is Manager Industrial Relations and Compensation Administration. And the issue that Mr. Stewart speaks about has to do with the law. Right? We are essential services. And the Industrial Relations Act doesn't recognize our essential services workers as workers under the Act. The Regional Health Authorities Act, which should have had the recognition process in it, doesn't. Right? What needs to happen is that the Regional Health Authorities Act needs to be changed, and you introduce the recognition process there, as they did for the teaching service in 1981. Right? We are simply following the law. Thank you.
Okay. CEO, we have several comments online and submitted by Ms. Bramble and Ms. Mutate regarding what plans and strategies have been formulated and will be implemented to address delay in payment of pensions for staff.
Sure, that is always a question when I walk the facilities, and I walk the facilities all. We good now? You all hearing? Yeah, so I was saying when I walk the facilities, and I do that a lot, and I interact with staff, pensions and increments are second to none in terms of questions that have been asked. And we have been moving in the HR department and IR and compensation towards right-sizing that. Our board subcommittee on finance has also, and HR has also been setting KPIs where that is concerned. But I would ask the manager compensation, which is our manager IR, just to speak about some of the strategies that we're putting in place to bring some level of ease and relief where that is concerned.
Thank you, CEO. Last year, what we did, we recognized that there were a number of persons who would not have received their pensions, even going back to 2019. And with the permission of the CEO, we had a special project that brought all those pension files up to date. Most of them are either with the Treasury or with the pension providers at this point. What we have recognized, though, is that while we establish a policy for the processing of pension files, the policy was not being carried out as it should. And therefore, again, we went into the institutions, we conducted training, and now we are holding them accountable. So we expect that this year and going forward, the pension files will be completed on time so that people will get their pensions in as short as possible time.
So, yeah, no, Justin can go back. I just wanted to let the audience know that this thing about improving the time for processing pensions is not a last year thing. Since we've been on this board, we have tasked the HR department to do just that, and there has been improvement. But let me say this. One of the challenges with processing pensions are records, HR records. They're all manual. And again, you will hear me constantly speak to digitalization in 2024 has to happen. And in that regard, we have to implement an HRIS system that will capture all our employees' data on a timely basis so that when it comes time to processing pensions, all of the employees' records are there and that pensions can be processed as quickly as possible. I agree. It is, to me, unacceptable that someone could have retired. You're taking my thing away? No, but it is really unacceptable that someone could have retired and they're still waiting for their pension a year, 2, 3 years after they have left the service. Unacceptable.
Just to add in that vein, I want to say that the RHAs currently have a combined tender out for HRS system. So we're moving towards that. We would have signed an MOU between all the CEOs of the RHAs to have a combined system procured.
Thank you. Yes, Dr. Amsahal.
Just one short question. I was just wondering what strategy can we use at the Northwest RHA to get other RHAs to do the mandates of the RHA Act of some 30 years now. What is happening is that RHAs like the Eastern RHA and the North Central have not taken ownership of their psychiatric patients. So we continue to do their satellite clinics, like you said, but that is really being the victims of abuse. We are really being abused by the other RHAs into looking after their patients for the last 30 years now. And the more we continue to do the satellite clinics, the less the incentive would be for them to take ownership of their patients. So that is my fear now, that in psychiatry, they would never take their patients. So I'm just wondering what strategy.
Sure, and I do have an answer for you, and it's multifaceted. One, sometimes the reward for good work is more work, right? And because the NWRHA has really been the leader in terms of mental health services, we've ended up in the position that we by default now see about everybody's mental health issues and so on. But you'd have seen in the presentation that the centralization of mental health is a key area of focus for the board and the management team, and obviously for the Ministry of Health. Yeah, and only this week I had a conversation with ERHA CEO on same, because I would have received correspondence from the doctors at Northwest speaking about the challenges of going up, leaving Northwest, going up to Toko, having to go to Mayaro and so on and do clinics. So we are in conversation about it. I want to say the CEOs meet on a weekly basis, and my colleague could bear me out in that regard. And this issue has been raised and will continue to be raised. I can provide you with some further feedback at a later date, because it is something that we're currently in discussions with. So Dr. Shafi, the DOH, and I are currently advocating for same. Yeah, but great question.
Yes, that is my fear as well. But we continue to work with the North Central Regional Health Authority and the Eastern Regional Health Authority to promote that. The Eastern Regional Health Authority does have a plan for community mental health team, and it is at the stage of the ministry. We at Northwest have helped them to develop a work plan for the staffing of their community mental health teams. At the North Central Regional Health Authority, you would have seen they have actually just advertised in the past few weeks for mental health officers and psychiatric social workers for the expansion of their mental health services. So we continue to work with them in that regard. And as we are on St. Anne's Hospital, we do have a question online, CEO, from Ms. Rogier. Can you give me any insight into the St. Anne's Hospital strategic goals and objectives for the next few years? Well.
So I was going to take the mic and refer it to the GM Mental Health, which coincidentally is Keisha.
Yes. Well, the St. Anne's Hospital strategic goals and development are really aligned to the Ministry of Health's National Mental Health Policy, which is a 10-year policy that was approved in 2019 to 2029. Specifically for St. Anne's Hospital, some of the strategic goals and objectives involve ensuring that all our primary care physicians and A&E doctors are trained in the execution of the MHGAP program. This is the Mental Health Global Action Plan program that trains primary care to assess, manage, and treat mild to moderate mental health conditions in primary care. And as I say that, Dr. Bagan, we have to formalize some dates for that. Another strategic goal for the St. Anne's Hospital is to reduce incidents of aggression and violence in mental health facilities. Another strategic goal, which is very dear to the Ministry of Health as well, is to reduce the risk of self-harm and suicide prevention in all facilities, to introduce alternative options to mental health patients, such as psychotherapy, occupational therapy, music therapy, and art therapy, to add a few. Do you want to add anything else, Dr. Shafi? Covered it, and do we have any other questions from participants here, apart from Mr. Stewart? I know.
Good evening, Joey Bartlett from Newsday. Unfortunately, I only have one question. Is the authority looking into using PrEP as a preventative drug to help in the fight against HIV?
I don't know what that drug is. I think, Dr. Bagan, you can answer. Please come forward.
Sorry, if I heard you correct, it was PrEP, right? Right. So PrEP, as in Israel. Sorry, it's really an acronym, but it's for preventative care. So what I would say is that we do use it in certain circumstances. So, for example, you have so that's pre-exposure prophylaxis. We use post-exposure prophylaxis regularly, so the drug is available. The only difference is that in terms of the ministry protocols, we don't really have the protocols to say that we prescribe it for PrEP, but it can be used. It's the same drugs, and we do have it available. It just depends on the situation and the clinic. So if you see a doctor, depending on the situation, he'll prescribe it accordingly.
Thank you, Dr. Bagan. We have some comments online, CEO, with regards to, from Ms. Frank. Why don't we have a staff doctor at the Port of Spain General Hospital?
Sure. So, good question again, but it is very difficult, given the number of facilities that I would have shown in the presentation, to provide a staff doctor at each facility. It is a resource. We would have spoken about our occupational health department at the St. James Medical Complex being expanded during COVID-19, and we continue to refine the offerings there. What we've done is to provide that facility for all Northwest Regional Health Authority staff, and all staff can avail themselves of the opportunities at the St. James Medical Complex for staff treatment, evaluation, and so on.
Thank you. We have a question here from Ms. Leanne and Ms. Peters. What is the future for the pharmacy services in the new central block?
I would ask future. Yeah. No, we. No, not only that, we have some. So, Dr. Barrow.
The new central block has an expanded pharmacy service that will take care of all inpatients and outpatient services. So it is currently what it is, and it is going to be expanded.
Thank you. Any more questions? Right. Well, Mr. Stewart, in the spirit of open dialogue, we invite you back for your 3 questions.
Yes.
Yeah.
And I would encourage, thanks again, I would encourage Northwest, if possible, that they could return to the National Library, if possible. It would allow more members of the public to be present and in person. Having said that, before I ask my 3 questions, I know that the Auditor General report made ERHA was also evaluated, and they found no issues during the same period that of 2022. No issues with ERHA, who had the same challenges of procurement as every other organization. Just want to make that point. Moving on to my other question. Sorry?
Hello?
Yes.
All right, so we all know. So while, I don't know specifics, I don't want you to juxtapose that and leave it there. But remember the size of ERHA, remember the patient load, remember they also didn't have a field hospital in ERHA, and a lot of their patients were being moved from ERHA and being treated by North Central and so on during COVID. So let's just keep the facts, where it needs to be.
I have no issues. I understand the explanation. I just wanted to mention that they had no issues. Yeah. And I know they had to acquire stuff the same way. I mean, when I go to NCRHA board meeting, I'm going to ask them the same question. Sure. $1 million a month for cutting grass. But anyhow, question 4. Pensions and gratuity. Again, and then increments added to that. There has to be something wrong. I hear the chairman speak about the HRIS platform coming on to deal with that. But since God was a child, this has always been an issue within the RHAs. Increments, outstanding increments, gratuity, pension, every single RHA has the same issue. Barring none, why cannot we get a hold on this? But so that's a real bugbear. If it was a nurse, I am just thinking, and the nurse is unable to execute their duties, they'll be disciplined by that same IRL gentleman who came up here. But why is it, and I know that persons within these departments are paid overtime to get this done. We always hear about overtime payments being made. We would have requested via information of the Freedom of Information Act. The amount of overtime is spent, and yet nursing and personnel and other workers are unable to get paid 2013 salaries as we speak, because we'll be still working on 2013 salaries. In any event, I move on. A question for HR. What is the nurse retention strategies? We did our own little survey. I know you like metrics and all of that. And we realized Northwest had the highest rate of nurses leaving within Northwest, higher than any other region, higher than Southwest, and Southwest is the largest employer. What is the retention strategies that Northwest is employing to retain staff on the establishment? And I take note, Northwest continues to be the only RHA in Trinidad that still have nursing personnel working temporarily employed. So is that something you all are proud of, that you all have nursing personnel who are leaving and to comfortably say you're not entitled to gratuity, you're not entitled to pension, we'll continue have you working on temporary employment. The only RHA in Trinidad. And the other issue with HR, again, retention strategies, the ability to be promoted is one of, besides salary, besides everything else, the ability to be promoted has always been an issue. Mental health officers have been lobbying for generations to have the mental health officer 2 position be brought on stream. I see that has been bypassed, and some team lead. I don't know what does supposed to that mean. A team lead position is now doing the job of what a mental health officer 2 ought to be doing. South has a mental health officer 2, so there's an opportunity for mental health officers 1 to be upgraded to mental officer 2. Why is it Northwest, which takes the lead in mental health, you'll just boast about that, why they are unable to have a mental health officer 2? Is it they want to have these persons? And let me just close off by saying, because Northwest, I want to commend you all on, you all are doing an excellent job on staff engagement, in human resource, a number of other cancer care. I mean, I hear you all speak about centers of excellence. It's a bandied about term, but I could say in oncology, definitely we have some of the best oncology staff in Trinidad and Tobago. In the Caribbean, it's comparable to none. I see some Dr. Quinlan here and a number of other doctors here. I want to commend them, and a number of nursing personnel. But I cannot say center of excellence for St. Anne's Hospital. I have worked there. I hear the cries of staff there. I cannot call that center of excellence by any stretch of the imagination. But I digress. So I want to thank you all for the opportunity, and I hope I have a job.
Thank you, Mr. Stewart. Give us a chance to answer your questions.
So let me start.
Yeah, well, we can start with the...
well, I know you have something on pensions first, but Keisha, you could go ahead on
if you had anything else, start with pensions. The psychiatric outpatient team lead was a position that has recently been introduced the last 6 months. The team lead position, there is no intention to replace the team lead position with the MHO2. As a matter of fact, we are still on track with trying to get the MHO2 position on board. Yeah.
Right. I know you would have also spoken about pension gratuity and increments. I think we spoke a little bit about that before, but needless to say, there is a recognition from the board and management team that this is an issue. And we're not hiding that issue, we're not trying to sugarcoat it. What the chairman would have said is that the files at this point in time, the great problem that we have seen is that employee files are manual at this time, and all this overtime and so on that you speak about is about taking a manual file and trying to bring it up to date. There are some inherent issues within that, bringing it up to date. So for instance, you may have issues where persons have overpayments on their file and so on, and those overpayments are additionally caused by the lack of an HRIS to be able to track when people go on leave, when they come back off, they continue to get paid, they may be acting in a position, they continue to act for a period, they didn't pick it up because the document didn't come down and so on. But all these things happen largely because you have a manually based system. Anybody here that has worked in private enterprise or any sophisticated system knows that with an HRIS, somebody goes on leave, a ticket is punched, that happens immediately, accounts, finance, HR, everybody on the same page. So while we may be talking about moving to a digital landscape, and you may be constantly hearing that, my brother, is the solution to a lot of these issues that we're seeing with increments, pension, gratuity, and so on. I also want to say, over the last quarter of 2023, almost every month, I would have taken reports to the board where we paid almost $5 million in increments, gratuity, and so on. So we are making strides in that regard, and the records will show that we have actually improved in terms of increment and pensions payment, but it will be solved, and overpayments, but it will be solved significantly once we have that HRIS system in place. I know you also spoke about nurse retention, and I'll ask our acting GM nursing to add, but I will start. So the first thing is, as you know, you and I have been in communication. The Northwest Regional Health Authority, as approved by the Board of Directors, are embarking on a permanency exercise for nursing personnel. We have reached some distance where that is concerned. We were expected to complete all the employee profiles in January 2023, and we're at the stage now that we're looking at auditing those files and ensuring that the funding is available to make the pension contribution part of it. I want to assure you that the board and management of Northwest is committed to this exercise, and as I said, we have reached a significant way in terms of that computation, and we expect that that exercise will be completed in this financial year. The other part of our strategy is our HR department would have spoken to training and education, and we've invested significant amounts of funding in nursing training and education. As a matter of fact, we have nurses going now on an operating theater program that is fully sponsored by the Northwest Regional Health Authority, and those programs not only extend to nurses, but nursing personnel like ENAs, PCAs, and so on. So let me give you an example. We have Central Block coming. We've identified certain nursing needs for Central Block, and we have actually front-loaded training for our nurses because we know that is the most critical staff in terms of operationalizing Central Block. So we have several of our nurses, dozens of our nurses, actually on full pay study leave now based on the investment we've made in them towards Central Block. So that is one. We've also offered scholarships to persons within the RHA for persons that qualify for the ENA program, so persons that may be clerical officers and so on that get into the ENA program. We've taken several of these names to the board for full pay study leave, which they've acceded to. And what we do, our retention strategy is to provide them with the courses and to tie them in terms of length of service based on the cost of that course they would have went on. You would have also attended a function with me, I believe, in 2022, where we'd have commissioned, I think, about between 15 and 20 new DHVs that the Northwest Regional Health Authority would have paid and trained, and all these DHVs would have been retained, and they currently work in our primary care system. So the strategy is multifaceted. It speaks to the permanency exercise. It speaks to retention through training and our training department providing retention. It speaks to us offering scholarships for the nursing personnel. It speaks to us constantly speaking to them and saying, look, there is opportunity here. We have 10 new operating theaters coming. There are opportunities for you to be an oncology nurse in terms of training. There's opportunity in pediatrics and so on. And I want to say Northwest Regional Health Authority, despite our challenges within the next year, will be the foremost place for nurses to work based on the things that we have coming up. Yeah?
Thank you, CEO. We want to thank you for all your questions and comments, and we invite you to continue to submit your questions and comments via the registration link, which will remain open for the next 7 days. You are also invited to continue to submit questions via our email health.services@nwrha.gov.tt. Okay, we aim to acknowledge and respond to all questions asked pertaining to the public board meeting within 48 hours. In closing, I would like to express thanks on behalf of the Board of Directors of the NWRHA and recognize all the hard work of the individuals that were involved in the preparation of this presentation. We would first like to express our sincerest gratitude to Ms. Lisa Agard, our chairman for the Northwest Regional Health Authority, for her continued guidance and dedication to the authority. To the supporting board members and the executive management team, thank you. It is with this continued guidance that the goals set out in this presentation will be accomplished in the upcoming financial year. Thank you, Nurse Baird, for your prayer at the start of the proceedings. To our CEO, Major Anthony Blake, we are grateful for your continued commitment and circumspective guidance that has steered the authority in the direction which facilitated the many accomplishments described during this presentation. We would also like to thank the members of staff of the Cascadia Hotel for their hospitality and logistical support in the setting up of this space. A huge thank you to the HPRP department, right, and the Corporate Communications Department, who worked tirelessly on the compilation of this presentation. Additionally, to all our members of staff of the NWRHA, thank you for your work. Without you, the members of the administrative staff, medical and nursing teams, all other categories of staff, the authority could not continue to be leaders in healthcare. To the media, thank you for being here today to assist us with reaching a wider audience. Most importantly, to the persons who use health services at our facilities, we welcome your continued comments and inquiries, and we invite you to continue to partner with us as we work towards the business of becoming champions in health. To our online viewers, we thank you for participating, and we will be signing off now.